The call came in at 6:43 a.m. Armed robbery in progress at the First National Bank on Maple Street. Officer James Mercer, 13 years on the Boston police force with commendations that filled a wall in his den, responded with the practiced calm of a veteran. His partner barely had time to brace himself before James accelerated their cruiser through a yellow light, siren wailing into the gray Tuesday morning. "Dispatch says 2 perps, possibly armed," James said, his voice steady as he navigated morning traffic with surgical precision. At 42, he was in the best shape of his life, 6'2" of solid muscle maintained by pre-dawn runs and weekend boxing sessions. The department had just cleared him for SWAT training, a goal he'd been working toward for years. Nodded, checking his weapon. "Remember that bank job on Commonwealth last year? Same MO." James didn't respond. A sudden wave of dizziness blurred the road ahead, streetlights smearing into starbursts across his vision. His hands felt strange on the wheel, distant somehow, as though they belonged to someone else. He blinked hard, shaking his head to clear it. "You okay, brother?" His voice seemed to come from far away. "Yeah," James managed, the nausea receding as quickly as it had come. "Just need more coffee." They arrived at the bank 3 minutes later, joining 4 other units in establishing a perimeter. James moved with tactical efficiency, positioning himself behind his open car door, service weapon drawn. The hostage negotiator was en route, but these situations were fluid, unpredictable. Every muscle in his body tensed, ready. That's when it happened. Without warning, James's legs simply gave out. He collapsed behind the cruiser, his gun clattering to the pavement. The world tilted sickeningly as confused shouts erupted around him. His face appeared above him, mouth moving, but James couldn't make sense of the words. A cold sweat drenched his body as tunnel vision constricted his world to a pinpoint of light, then nothing. He woke in Mass General, electrodes attached to his chest and an IV in his arm. Sarah, his wife of 15 years, clutched his hand, her green eyes rimmed with red. "Hey, stranger," she whispered, forcing a smile that didn't reach those eyes. "You gave us quite a scare." "The bank robbery," James started, trying to sit up. "They got them," Sarah assured him, gently pressing him back against the pillows. "Everyone's fine. Took down 1 suspect and the other surrendered." Dr. Maxwell, the attending physician, explained that James had experienced an unexplained syncopal episode, a fancy way of saying he'd fainted for no apparent reason. Blood work, EKG, and a CT scan all came back normal. "Probably just dehydration, maybe a virus," the doctor said with the casual confidence of someone who'd seen it all. "Take 3 days, get some rest, and follow up with your primary care if you experience any other symptoms." 3 days turned into a week as James battled crushing fatigue unlike anything he'd experienced before. The room spun when he stood too quickly. His normally hearty appetite disappeared. Sarah watched with growing concern as he picked at his food, his uniform beginning to hang loose on his frame. "I'm fine," he insisted when she suggested another doctor's appointment. "Just need to get back in the gym." But the next morning, she found him in the bathroom, gripping the sink, staring with confusion at the toothpaste as if he'd forgotten what it was for. Doctor, their family physician for nearly a decade, listened carefully as Sarah detailed the changes in her husband over the past 3 weeks. James sat on the examination table, embarrassed by what he considered a fuss over nothing, even as he struggled to remember the date when the doctor asked. "Any headaches, vision changes?" doctor asked, shining a penlight into James's eyes. "Some," James admitted reluctantly, "and sometimes my hands shake." The tremor became evident as he extended his arms. Fine at first, barely noticeable but impossible to control after 30 seconds. Doctor's expression remained neutral, but Sarah caught the flicker of concern. "I'd like to run some tests," he said, scribbling on a prescription pad. "Blood work and MRI, and I want you to see a neurologist." The next few weeks blurred into a parade of waiting rooms and specialists. Doctor, the neurologist, ordered a battery of tests that found nothing conclusive. Your symptoms suggest several possibilities, she explained. Multiple sclerosis, early-onset Parkinson's, or perhaps an atypical presentation of Lyme disease. James's condition continued to deteriorate. The department placed him on medical leave after he became disoriented during roll call, unable to recognize the lieutenant he'd worked with for years. The tremors worsened, becoming full-body shakes that left him exhausted. Weight fell from his frame despite Sarah's desperate attempts to tempt him with favorite foods. By month 3, James needed help showering. The man who once chased suspects across rooftops now unsteady on the short walk from bedroom to bathroom. Sarah took family medical leave from her teaching position, becoming his full-time caretaker. Their savings dwindled as medical bills mounted, each specialist more expensive than the last. Something's eating him from the inside, a young resident told his supervisor, not realizing Sarah could hear them from the hallway. It's like watching someone disappear by inches. The police department around one of their own. Officers organized meal trains and fundraisers. James's partner visited daily, bringing station gossip and forced cheer that grew harder to maintain as James became increasingly vacant, sometimes not recognizing his old friend. Doctor at Massachusetts General ordered a spinal tap that revealed elevated protein levels but no definitive diagnosis. Dr. Wilson at Beit Israel suggested an autoimmune disorder and prescribed high-dose steroids that left James diabetic but no better. Doctor wondered about environmental toxins and ordered heavy metal screenings that came back negative. 6 months after his collapse, James Mercer was a ghost of himself, 40 pounds lighter, confined mostly to bed, periods of confusion now outweighing moments of clarity. His speech slurred when he could speak at all. Specialist number 12 suggested hospice care. "We're running out of options," he told Sarah gently in the hospital corridor. James sedated in the room behind them after a particularly violent seizure had fractured 2 of his ribs. "We've ruled out the common causes and most of the uncommon ones. I can refer you to a few research hospitals, but—" He trailed off, the unspoken reality hanging between them. Sarah stood straight, the exhaustion of half a year showing in the new lines on her face. "I won't give up on him." That night, she found James's fellow officers huddled in the hospital waiting room. She overheard fragments of their conversation, funeral arrangements, honor guard, pension benefits for survivors. They fell silent when they noticed her, faces etched with pity and the awkward guilt of the healthy in the presence of inevitable tragedy. At home, Sarah discovered the precinct had already started planning a memorial service. A draft program had been accidentally included in a care package dropped off by the police chaplain. Officer James Mercer's name followed by dates, the second one left blank but clearly anticipated soon. In their bedroom, she opened James's nightstand and found the letter he'd written during a moment of lucidity, addressed to her to be read after. She couldn't bring herself to open it. Instead, she curled beside his empty side of the bed, inhaling the fatting scent of him from his pillow, and made a promise to the darkness. "I will find what's killing you," she whispered. "If I have to fight every doctor in Boston." The morning air carried an antiseptic chill as Sarah pushed James's wheelchair through the sliding doors of John's Hospital. 8 months had passed since his collapse, and this was their 4th major medical center. The wheelchair, once temporary, now a permanent fixture, seemed to shrink with each passing week as James's once powerful frame continued to waste away. Mrs. Mercer, a tall woman in a crisp white coat, approached, hand extended. "I'm Doctor, head of neurology. We've reviewed Officer Mercer's files." Sarah nodded, dark circles beneath her eyes testament to another sleepless night. She'd stopped counting after 60. All of them. "All 15 pounds, Doctor confirmed with a small smile. "Quite the medical odyssey you've been on." James stirred in the wheelchair, a moment of lucidity breaking through the fog that now clouded much of his day. 17 doctors, he managed, his once commanding voice reduced to a rasp. No answers. 18 now, doctor corrected gently, but I hope to change the pattern. Hope. Sarah had learned to be wary of that word. She'd heard it from Dr. Phillips at Mass General, who was certain James had a rare autoimmune disorder until the tests came back negative. From Doctor at Mayo Clinic, convinced it was a prion disease until those theories collapsed too. From Dr. Reeves at Cleveland Clinic, whose promising experimental treatment had triggered seizures so severe that James had to be placed in a medically induced coma for 3 days. The next hours blurred into a familiar routine of forms and questions, Sarah reciting the litany of symptoms and failed treatments with the mechanical precision of someone who had told the story too many times. Declining muscle control, intermittent aphasia, progressive cognitive impairment, tremors, seizures, weight loss despite supplemental nutrition, periods of confusion interspersed with devastating clarity. The hardest part, Sarah confided when James dozed off during a break in testing, is when he's completely himself. He'll look at me with recognition, squeeze my hand, say something perfectly normal, and then it's gone like a radio losing signal. Doctor nodded, making notes in a leather-bound journal rather than the tablets the other specialists had used. Old school, methodical. I notice he's been through 4 different MRI protocols, but no one's tried spectroscopy. SPECT. Magnetic resonance spectroscopy. It looks at metabolic changes in brain tissue rather than just structure. Sometimes it catches what traditional imaging misses. A flicker of that dangerous hope ignited in Sarah's chest. She tamped it down, having learned that expectations were just pre-packaged disappointments. When can you do it? I've scheduled it for tomorrow morning. Tonight, we'll do a sleep study and a 24-hour toxicology panel. Different questions sometimes yield different answers. That night in the hotel room adjacent to the hospital, Sarah spread the contents of a manila folder across the bed. Copies of James's test results, specialist reports, treatment plans. Looking for patterns, connections, anything the 18 doctors might have missed. Her laptop glowed with open tabs, medical journals, rare disease forums, clinical trial registries. The wall calendar showed missed mortgage payments, their savings long since exhausted. She'd sold their second car last month. The vacation cabin would be next. Her phone buzzed with a text from, "Any news from the new doc?" James's partner had remained steadfast even as other colleagues had gradually stopped visiting, their awkward silences and pitying glances too difficult to bear. "Not yet, more tests tomorrow," she typed back. The phone rang almost immediately. "Sarah, listen." His voice carried the tense urgency she recognized from his police work. "I've been digging into similar cases. 3 officers from different departments who worked that joint training exercise in Rico last year have reported neurological symptoms. Nothing as severe as James, but there might be a connection." Sarah sat up, reaching for a notepad. "Names?" "Can't share officially, but I've sent an email with some contacts. Maybe worth mentioning to the new doc." The next morning, Sarah relayed this information to Doctor, who added it to her growing file. "Environmental exposure is definitely on my radar," the doctor assured her, "though I'm puzzled why it would affect your husband so much more severely." "James was always first in line," Sarah explained. "First to volunteer, first through the door on tactical maneuvers, if there was something in the training environment." The Mrs. Scan took over 2 hours. Sarah watched through a window as James lay motionless in the massive machine, sedated to prevent the tremors from corrupting the imaging. Afterward, in the consultation room, Doctor displayed the colorful brain imagery on a large monitor. "There are metabolic abnormalities in his basal ganglia and cerebellum," she explained, pointing to ominous dark patches. "Consistent with neurotoxin exposure, but not matching the profile of any common environmental toxins, and his blood work continues to show no signs of infection or systemic inflammation." "So we're still nowhere," Sarah said flatly. Not nowhere, doctor countered. We've eliminated several possibilities and identified a pattern of damage. It's progress. She hesitated. There's one more test I'd like to try, though it's somewhat experimental. Positron emission tomography with a new tracer that binds to proteins. 3 days and one more inconclusive test later, Sarah sat in doctor's office for what she knew would be another dead end. The doctor's expression confirmed it before she spoke. I've consulted with colleagues at NIH and, doctor began. We're considering several rare possibilities, exotic neurotoxins, atypical presentations of encephalopathies, even some emerging pathogenic mechanisms that don't follow classical disease patterns. Sarah had learned to translate medical jargon. You don't know. No, doctor admitted. We don't know. She closed her leather journal. I'd like to admit James for another week of observation. We can try plasmapheresis, which sometimes helps with unknown autoimmune conditions, and when that doesn't work, Sarah interrupted, unexpected anger burning through her exhaustion. Then what? Another referral, another specialist with more tests and no answers. She gestured to James, slumped in his wheelchair, unaware of the conversation that would determine his fate. Look at him. He doesn't have time for the medical community to figure this out. Doctor didn't flinch from Sarah's anger. There's an NIH research program. With a 6-month waiting list, he'll be dead in 6 months. The words hung in the air between them, the first time Sarah had said aloud what the doctors had been implying for months. She felt a strange relief in finally acknowledging it. Doctor leaned forward. Mrs. Mercer, I understand your frustration, truly, but medicine has limitations, sometimes. Don't, Sarah whispered. Don't tell me to prepare for the inevitable. Don't tell me to consider hospice care or to focus on his comfort. The 19th doctor will say the same thing the 18th did, and I can't. Her voice broke. I can't watch him disappear while everyone keeps telling me to accept it. On the flight home, as James slept fitfully under the influence of anti-seizure medications, Sarah stared out the window at the clouds below. They seemed solid enough to walk on, though she knew they would prove insubstantial if tested, like medical certainty, like hope. The hospice nurse was scheduled to evaluate their home the following week. The neurologist at Mass General had prescribed comfort care only. A priest had gently suggested last rites. Not yet, Sarah whispered to the sleeping form of her husband. I'm not giving up, not while there's anything left to try. She pulled out her tablet and began searching again, moving beyond traditional medicine into territories she would have dismissed a year ago as desperate pseudoscience. Something was killing James Mercer, something 20 specialists across the country's best medical institutions had failed to identify. If established medicine couldn't save him, she would have to look elsewhere. Medical detection dogs. Sarah, you can't be serious. Michael, Sarah's older brother and a pharmacist at Boston Memorial, stood in her kitchen with an expression that mingled pity and exasperation. The late autumn light filtering through the windows did little to brighten the room, which had taken on the unmistakable atmosphere of illness, pill organizers on the counter, a hospital bed visible in the converted dining room, the lingering scent of antiseptic competing with the potpourri Sarah used to mask it. I'm beyond serious, Sarah replied, her voice low to avoid waking James. She pushed a printout across the kitchen island. Look at the research. These dogs can detect cancer cells with higher accuracy than some laboratory tests. They've identified early Parkinson's before clinical symptoms appear. Michael skimmed the article, his skepticism evident. That's different. Those are established protocols for specific conditions. James has an undiagnosed mystery illness that 20 specialists couldn't figure out. 23 now, Sarah corrected. The latest neurologist had suggested palliative care only, his gentle tone doing nothing to soften the blow. And none of them could explain why his condition continues to deteriorate while his tests show nothing conclusive. Which is exactly why this seems like grasping at straws. Michael's voice softened as he took in his sister's exhausted face. At 38, Sarah looked a decade older than she had a year ago. I understand you're desperate, but miracle cures and… This isn't some miracle cure, Sarah cut in, sliding another article toward him. This is peer-reviewed research from Johns and the University of Pennsylvania. These dogs are trained to detect biochemical markers we don't fully understand yet. Their olfactory capabilities can identify concentrations as low as parts per trillion. Even if that's true, where would you even find such a program? And how would you pay for it? Your insurance has already half the conventional treatments. Sarah pulled up a website on her tablet. The Foundation in Arizona. They're expanding their research into neurological conditions and unusual pathogenic responses. They're taking applications for their clinical trial. Michael examined the site. There's a 2-year waiting list. That's for their standard program. The research division is different. And the cost? Sarah hesitated. $30,000. Jesus, Sarah. Michael rubbed his temples. You've already remortgaged the house. You sold your car. The department fundraiser barely covered last month's hospital bills. I'm selling my engagement ring, Sarah said quietly, and the vacation cabin goes on the market next week. Michael stared at his sister, the weight of her determination hitting him fully. You really believe this could work? It wasn't a question, but Sarah answered anyway. I have to believe something will, because the alternative is watching him die by inches while doing nothing. She turned toward the window, blinking back tears. I can't accept that. Not yet. That night, after Michael left and James was settled for the evening, Sarah completed the online application for the foundation. The form asked for detailed medical history, symptoms, and previous treatments, information she had compiled in a 3-inch binder that accompanied them to every appointment. She attached the most relevant test results and imaging studies, then paused at the final section. Please explain why you believe your case would benefit from our medical detection program. Sarah stared at the blank field for nearly an hour before the words finally came. My husband is dying of an invisible enemy, she wrote. Something is systematically destroying him from the inside out, something 23 specialists at the country's finest medical institutions cannot identify. James dedicated his life to protecting others as a police officer. He never hesitated to be first through a door when civilians were in danger. Now, medicine has given up on him, but I refuse to. He deserves every possible chance, every avenue explored, no matter how unconventional. Please consider his case not just for him, but for what it might teach us about detecting the undetectable. She hit submit before she could second-guess herself, then closed her laptop and went to check on James. He was awake, one of his increasingly rare periods of lucidity evident in his clear gaze. Hey, she said softly, taking his trembling hand. His fingers, once strong enough to help move furniture without breaking a sweat, now felt fragile as bird bones. Hey yourself, he replied, his voice a hoarse whisper. Bad day. Sarah managed a smile, getting better now. James's eyes flicked to the laptop she'd set on his bedside table. What's the new plan? I know that look. Even diminished, he could still read her so well, just exploring some options. Sarah, he squeezed her hand with what little strength he had left. I need you to consider something. It might be time to… Don't, she interrupted, unable to bear hearing him suggest what the doctors had been implying for months. Not tonight. I'm not getting better, he said gently. We both know it. There's a point where fighting just prolongs the inevitable. The inevitability of death isn't what I'm fighting, Sarah replied, surprising herself with the calm certainty in her voice. It's the assumption that we've exhausted every possibility, that we know everything there is to know. She kissed his forehead. Rest now. Tomorrow's another day. 3 weeks passed with no response from the foundation. Sarah continued James's care routine. Medications, physical therapy exercises to slow muscle atrophy, regular turning to prevent bed sores. The home health nurse visited twice weekly, her gentle efficiency a momentary relief from the constant vigilance that had become Sarah's life. Stopped by every other day, sometimes just sitting with James in companionable silence, while Sarah took a much-needed shower or walk around the block. Her brother called daily, alternating between concerned support and practical suggestions about hospice options. Her mother had started sending funeral arrangement pamphlets, horrifying Sarah with their gentle floral borders and tasteful font choices. "They're just trying to help," told her one evening as they sat on the porch, the crisp November air a welcome change from the overheated house. "Everyone processes grief differently." "I'm not grieving yet," Sarah insisted, pulling her cardigan against the chill. "Grief implies acceptance." Studied her face in the porch light. "Sarah, I've seen what denial does to families in crisis. Her phone rang, interrupting whatever well-intentioned advice he'd been about to offer. Unknown number with an Arizona area code. "Mrs. Mercer, this is Doctor from the Foundation." The woman's voice carried a slight accent, each word precisely enunciated. "I'm calling about your application to our neurological research program." Sarah's heart pounded as she gripped the phone. "Yes. We've reviewed James's case files. It's unusual." Doctor paused. "Typically, we work with established diagnoses to train our dogs on specific biomarkers. Your husband's condition presents a different challenge." "I understand," Sarah said, already feeling the familiar weight of another rejection settling onto her shoulders. "Thank you for considering. However," Doctor continued, "your case has caught the attention of our research director. We're interested in expanding our capabilities to identify unknown pathologies. James's situation might provide valuable data." Sarah closed her eyes, scarcely daring to hope. "What does that mean?" "It means we'd like to include him in our pilot program. We have a recently certified medical detection dog named Luna who's shown exceptional aptitude for identifying unusual biochemical patterns. She would be assigned to your case if you're still interested." "When?" Sarah managed, her voice barely above a whisper. "There's a cancellation in our current cohort. We could have Luna to you within 2 weeks, assuming you can arrange for the program fee." "I can," Sarah said quickly, though she had no idea how she would come up with the remaining amount. The ring and cabin sale would cover about half. 2 weeks. "Yes, I should note that this is experimental. There are no guarantees." "I understand. We'll be ready." After ending the call, Sarah turned to find watching her with raised eyebrows. "Good news." For the first time in nearly a year, Sarah felt a genuine smile spread across her face. Maybe, just maybe. Later that night, she sat beside James's bed, holding his hand as he slept. "Help is coming," she whispered, allowing herself to feel something she had almost forgotten. Hope. Just hold on a little longer. Something even the best doctors missed might be found by a completely different kind of detective. Sarah stood at the window, watching the silver pull into her driveway. The November morning was bright but cold, frost still clinging to the grass despite the late morning hour. She smoothed her sweater and tucked a strand of hair behind her ear, suddenly self-conscious about the appearance of both herself and the house. For nearly a year, their home had been a facto medical facility. Now she found herself hoping it didn't smell too much like one. 2 figures emerged from the car. A petite woman with silver-streaked black hair pulled into a professional bun, and beside her, a chocolate Labrador retriever whose rich brown coat gleamed in the sunlight. The dog moved with a fluid grace that spoke of careful breeding and extensive training, alert but calm as she surveyed her new surroundings. Sarah opened the front door before they reached it. "Doctor." The woman extended her hand. "Please, and this is Luna." The dog looked up at the sound of her name, intelligent eyes assessing Sarah with what seemed like genuine curiosity. There was nothing of the stiff, serious demeanor Sarah had expected in a working animal. Luna's tail wagged in a gentle sweep, her posture attentive but relaxed. "She's not what I expected," Sarah admitted as she ushered them inside. Smiled. "People often expect medical detection dogs to be as somber as doctors in white coats, but Luna's still a dog, a highly trained one with an extraordinary nose, but a dog nonetheless." The home health nurse, Ms., appeared in the hallway. "Officer Mercer is awake and ready for visitors," she said with her usual quiet efficiency. "I've finished his morning care routine." Sarah led them to the converted dining room where James's hospital bed had been set up months ago when stairs became too difficult to navigate. The space had been transformed with medical equipment, but Sarah had fought to maintain some normalcy. Family photos on the walls, James's police commendations displayed on a shelf, fresh flowers on the windowsill that she changed weekly no matter how tired she was. James was propped up against pillows, his once powerful frame now painfully thin beneath the blankets. Despite his deterioration, Sarah had insisted on maintaining his dignity. His face was freshly shaved, his hair neatly combed, dressed in a clean button-down shirt rather than a hospital gown. "James, this is Doctor from the Foundation in Arizona, and Luna, the medical detection dog I told you about." James's eyes, still startlingly blue despite the illness that had dimmed everything else about him, focused on their visitors. He managed a slight nod, one of the few movements he could still control reliably. His speech had become increasingly limited over the past weeks, but his comprehension remained intact during his lucid periods, a cruel mercy that left him aware of his body's betrayal. Approached the bed, Luna beside her. "It's good to meet you, Officer Mercer. I've reviewed your medical files extensively. Your case is quite remarkable from a diagnostic perspective." Something flickered in James's eyes, a ghost of the wry humor that had once been so characteristic of him. Even now, he could appreciate the irony of his medical mystery being remarkable. "I'd like to explain how Luna works," continued, pulling up a chair. "She's been trained to detect specific biochemical markers associated with various conditions. Most medical detection dogs are trained for a single disease, cancer, diabetes, even COVID. But Luna is part of our research division. She's what we call a pattern dog, trained to identify unusual biochemical profiles rather than specific conditions." Sarah sat on the edge of James's bed, taking his hand. "How does the process work?" "First, Luna needs to become familiar with James's baseline scent profile. She'll spend today just being in his presence, acclimating to his normal biochemical state. Tomorrow will begin more directed work." As if on cue, Luna, who had been sitting obediently beside, suddenly stood and approached the bed, seemed surprised. She usually waits for a command before. The dog ignored her handler, moving closer to James with intent focus, her nose working actively. Then something extraordinary happened. Luna whined softly and placed her front paws on the edge of the bed, stretching her neck to sniff more thoroughly at James's right leg beneath the blanket. "Luna, down," commanded, clearly embarrassed by this breach of protocol. "I'm so sorry, she's never done this before with a new patient." But Luna ignored the command, another unprecedented event, according to wide-eyed expression. The dog became increasingly agitated, pawing at the blanket covering James's leg and emitting a high-pitched whine. "What's happening?" Sarah asked, alarmed but also intrigued by the dog's sudden intensity. Shook her head, her professional composure momentarily shaken. "I'm not sure. This is highly unusual behavior, especially for Luna. She's one of our most disciplined dogs." James managed to lift his hand a few inches off the bed, reaching toward Luna. The gesture seemed to calm her slightly, though she remained fixated on his right leg. "She's detecting something," said, her voice taking on a clinical tone as she recovered her professional demeanor. "May I?" She gestured toward the blanket. Sarah nodded and carefully folded back the covers to expose James's legs, clad in loose pants. Luna immediately pressed her nose against his right calf, moving up to his thigh with singular focus, then circled to his right side, nose working frantically around his lower abdomen. "Has James complained of any specific pain in these areas?" asked, watching Luna's behavior with intense interest. Sarah shook her head. "No more than anywhere else. The doctors attributed his generalized pain to neurological deterioration." Luna suddenly barked sharply, causing everyone in the room to jump. She returned to James's right thigh, pawing insistently at a specific spot, then looking up with what could only be described as urgency. "I've never seen her so definitive," murmured, reaching for her phone. "Would you mind if I recorded this?" For the next hour, they observed as Luna repeatedly returned to the same areas of James's body, ignoring all commands to stop or redirect. When James was moved for his scheduled physical therapy, the dog became visibly distressed, barking anxiously until he was returned to the room. "She's found something," finally said, putting away her phone after capturing extensive footage. "I've never seen such consistent alerting behavior without prior training for a specific condition." "What does it mean?" Sarah asked, hardly daring to hope. "I'm not sure yet," admitted. "But Luna is detecting biochemical markers that are triggering her alert response. There's something specific about James's right leg and lower right abdomen that's registering as abnormal to her." 23 doctors found nothing with millions of dollars of advanced equipment, Sarah said, skepticism warring with desperate hope. "A dog's nose has up to 300 million olfactory receptors compared to our 6 million, explained. They can detect some compounds in parts per trillion. That's equivalent to a drop of liquid in 20 Olympic-sized swimming pools. More importantly, they process scent differently than our instruments do, sometimes picking up patterns our technology misses." Sarah watched Luna settle protectively beside James's bed, her eyes never leaving him. "What now?" "Now," said, reaching for her laptop, "I contact our medical director and request targeted testing based on Luna's alerts. We need to focus specifically on James's right leg and right lower quadrant." She hesitated. "I know this might seem far-fetched after everything you've been through, but Luna has never behaved this way without there being something significant to find." For the first time in months, Sarah felt something unfamiliar stirring in her chest, not just hope, but conviction. The dog's certainty was too compelling to dismiss. "James's neurologist said no more tests," she said, remembering Dr. Foster's gentle but firm recommendation to focus on comfort care. "He said we've exhausted all diagnostic avenues." Looked up from her laptop, her expression resolute. "With all due respect to Dr. Foster, he doesn't have Luna's nose, and Luna is telling us, quite emphatically, that there's something in your husband's right leg that deserves another look." As if understanding she was being discussed, Luna rested her head on the edge of James's bed, her brown eyes fixed on his face with unwavering attention. James managed to lift his fingers just enough to brush against her ear, the ghost of a smile flickering across his face. "I think," Sarah said slowly, watching this silent communication between her husband and the dog who had known him for less than 2 hours, "it's time to make some calls. Reviewed your husband's file extensively, Mrs. Mercer. There's simply no medical justification for additional imaging studies." Dr. Foster's voice carried the practiced patience of someone who had delivered difficult news many times. His face on the video call was professionally composed, but Sarah detected the underlying message. He thought she was grasping at straws. "With respect, doctor," interjected from beside Sarah, "Luna's alert behavior is extremely specific and consistent. She's identifying something in Officer Mercer's right thigh and lower right quadrant." Dr. Foster's sigh was barely audible. "Doctor, I understand your foundation does valuable work, but Officer Mercer has multiple full-body MRIs, CT scans, and ultrasounds. There's nothing in his leg or abdomen that explains his neurological symptoms. Sarah leaned forward, fighting to keep her voice steady. Luna hasn't left James's side for 3 days. She becomes distressed when anyone touches his right leg, and she's repeatedly alerted to the same specific areas. This isn't random behavior. Dogs can be incredibly intuitive about human suffering, Dr. Foster acknowledged. But that doesn't mean. This isn't about intuition, cut in, her professional demeanor belied by the color rising in her cheeks. Luna is trained to detect biochemical markers. Her accuracy rate in controlled studies exceeds 97%. That's better than many laboratory tests. Dr. Foster's expression remained unchanged. Even if the dog is detecting something, what exactly do you want me to do? We've exhausted all standard imaging protocols. Not all of them, countered. She opened a folder on the table. There's a new high-resolution MRI technique using enhanced T2 weighted sequences that can detect subtle changes in tissue density. It was developed for identifying early-stage gliomas before they're visible on standard MRI. That protocol is experimental, Dr. Foster said dismissively. Insurance won't cover it, and it's only available at a handful of research hospitals. Boston University Medical Center has it, Sarah said quietly. I checked yesterday. Dr. Foster's eyebrows rose slightly, the first crack in his professional veneer. Even if that's true, there's a waiting list for research protocols, and again, without medical justification. The police department has offered to cover the cost, Sarah interrupted. James's partner spoke to the chief. They're willing to use funds from the Officer Support Foundation. This wasn't entirely true, had mentioned the possibility, but nothing had been confirmed. Sarah silently apologized for the white lie. There was a long pause as Dr. Foster seemed to weigh his options. Finally, he sighed. I'll make some calls, but I need to be clear. I'm doing this to eliminate a possibility, not because I believe it will yield results. And Mrs. Mercer, his voice softened slightly, I'm concerned that pursuing additional tests might delay important conversations about your husband's comfort and care. After the call ended, squeezed Sarah's shoulder. He's wrong, you know. Luna's telling us something important. Sarah nodded, watching through the doorway as Luna lay beside James's bed, her chin resting protectively on his blanket. I believe her. 2 days later, Sarah sat in an uncomfortable plastic chair in the BU Medical Center's imaging department waiting room. James had been taken in 30 minutes earlier for the specialized MRI. Doctor, the young radiologist who had agreed to perform the scan as a professional courtesy to Dr. Foster, had seemed more intrigued than skeptical when Sarah explained Luna's behavior. High-resolution T2 weighted sequences can pick up subtle abnormalities in tissue density and composition, he'd explained while preparing James for the scan. If there's something there, we'll find it. Had remained at the house with Luna, who had become increasingly agitated when they'd prepared to take James to the hospital. She doesn't want to lose sight of him, had observed. It's unusual behavior even for a medical detection dog. She's formed an extraordinarily strong bond with him in just a few days. Sarah checked her watch again. The scan was taking longer than expected. She tried to quiet the dueling voices in her mind, hope insisting this would finally yield answers, fear whispering that she was delaying the inevitable. Doctor appeared in the doorway, his expression unreadable. Mrs. Mercer, the scan is complete. I'd like to show you something. Sarah's heart hammered as she followed him to a darkened room lined with computer monitors. James was being transferred back to his wheelchair by medical assistants. She gave him a reassuring smile as they passed. I've never seen anything quite like this, Doctor said as he pulled up a series of images on the largest monitor. The standard MRIs missed it entirely, but with the enhanced protocol. He pointed to a small, irregularly shaped mass deep in James's right thigh muscle. There's an encapsulated abscess here, approximately 2 centimeters in diameter, And here, he switched to another image showing James's lower abdomen. There's evidence of lymphatic involvement extending to this region. Sarah stared at the screen, the tiny glowing anomaly representing either salvation or another dead end. What does it mean? It's difficult to say without further testing, but the imaging characteristics suggest an encapsulated infection. Doctor, enlarge the image. See how it's walled off from surrounding tissue? That's unusual. Typically, infections spread more diffusely through tissue planes. This looks almost contained, as if the body has imprisoned it. Could it be causing his symptoms? Possibly. Doctor's tone was cautious, but Sarah detected something she hadn't heard from a medical professional in months: genuine interest. If it's producing neurotoxins that are leaking into his bloodstream despite the encapsulation, that could explain the neurological presentation. We'd need to aspirate fluid from the site to confirm. When can you do that? I can perform an ultrasound-guided needle aspiration right now if you consent. Dr. Foster has already approved the procedure. He hesitated. I should warn you that this may be another dead end. Many conditions can cause abscesses, and most don't explain your husband's overall condition. Do it, Sarah said without hesitation. The aspiration procedure took less than 30 minutes. Sarah held James's hand throughout, his eyes following Doctor's movements with newfound alertness, as if he somehow understood the significance of what was happening. We'll send this to the lab for comprehensive analysis, Doctor explained, as he carefully labeled the vials containing a small amount of cloudy fluid. I've requested expedited processing, but it might still take 24 to 48 hours for complete results. It was nearly midnight when Sarah's phone rang. She had been dozing in the armchair beside James's bed, Luna curled at her feet. The dog raised her head alertly at the sound. Mrs. Mercer, this is Doctor. His voice thrummed with barely contained excitement. I'm sorry to call so late, but I thought you'd want to know immediately. The preliminary lab results are in. Sarah was instantly fully awake. What did they find? Something extraordinary. The fluid from the abscess contains a fungal organism that the microbiology team is still working to fully identify. But it's producing a powerful neurotoxin with properties similar to tetrodotoxin, a nerve agent that can cause progressive neurological symptoms consistent with your husband's condition. Sarah's hand tightened around the phone. Are you saying you found what's been causing his symptoms? It appears that way, Doctor confirmed. The abscess is essentially a reservoir of toxin-producing fungi that has been slowly poisoning your husband for months, possibly years. Because it's encapsulated, it didn't trigger the usual immune markers we look for in, and its location deep in the muscle tissue made it easy to miss on standard imaging. Tears spilled down Sarah's cheeks as the weight of 23 failed diagnoses began to lift from her shoulders. Can it be treated? Yes, Doctor said confidently. Now that we know what we're dealing with, we can develop a targeted treatment protocol. I've already consulted with an infectious disease specialist doctor who has experience with rare fungal infections. She wants to begin aggressive antifungal therapy immediately, combined with surgery to remove the abscess. The dog found it, Sarah whispered, reaching down to stroke Luna's head. When every doctor and every test failed, Luna knew exactly where to look. It's remarkable, Doctor agreed. I'd like to document this case for a medical journal, with your permission. The implications for medical detection dogs in diagnosing obscure conditions could be significant. After ending the call, Sarah knelt beside Luna, burying her face in the dog's soft fur as tears of relief flowed freely. You saved him, she whispered. You found what everyone else missed. Luna nuzzled against her, then turned to gaze at James, who slept peacefully for the first time in months. In the dim light of the bedside lamp, Sarah could have sworn the dog looked proud. The conference room at Boston Medical Center hummed with an energy Sarah hadn't encountered in the medical community for months. Gone was the gentle resignation that had characterized recent discussions about James's care, replaced by the focused intensity of specialists with a tangible problem to solve. Doctor, a compact woman with steel-gray hair and the brisk efficiency of someone perpetually short on time, stood at the head of the table. As one of the country's foremost experts on rare fungal infections, she had canceled a speaking engagement in Chicago to oversee James's case. She announced, pointing to a microscope image projected on the screen, an extremely rare fungal pathogen typically found in tropical and subtropical regions. The strain we've isolated from Officer Mercer's abscess most closely matches variants documented in Rico and parts of Central America. Sarah, and exchanged glances, had mentioned other officers from the Rico training exercise developing neurological symptoms. Sarah made a mental note to follow up on that connection. The unusual feature in this case, Doctor continued, is the encapsulation. Typically, C causes pulmonary infection before potentially spreading to the central nervous system. In Officer Mercer's case, it appears the initial infection occurred through deep tissue inoculation, possibly through an unnoticed puncture wound, and then formed this remarkable self-contained abscess. Doctor, who had discovered the abscess on the specialized MRI, leaned forward. And the neurotoxin production. That's what makes this case so extraordinary, Doctor replied, clicking to another slide. This particular strain is producing a complex of neurotoxins similar to those seen in certain marine organisms. The toxins have been leaking into Officer Mercer's bloodstream at low but consistent levels, causing the progressive neurological deterioration. Why wasn't it detected in his? Sarah asked, the question that had haunted her for months finally finding voice. The encapsulation, Doctor explained. The fungus created what we call a biofilm, essentially a protective barrier that kept the infection isolated from the immune system. The toxins were able to leach through this barrier in quantities sufficient to cause symptoms, but too small to trigger systemic inflammatory markers that our standard tests look for. And the treatment? Asked, her notebook open beside her. She had been documenting everything meticulously for the Foundation's research. Doctor's expression grew more serious. We're entering challenging territory. The treatment protocol I'm proposing is aggressive and carries significant risks. She turned to Sarah. I want to be completely transparent about what lies ahead. Sarah straightened in her chair. After months of uncertainty, even difficult truths felt like progress. Please do. We need a three-pronged approach, Doctor explained. First, surgical excision of the primary abscess in his thigh and the affected lymph tissue in his abdomen. Second, an aggressive course of specialized antifungal medications, some of which are still in clinical trials. And third, supportive therapy to address the neurological damage that's already occurred. What are the risks? Sarah asked, steeling herself. The antifungal regimen is particularly concerning, Doctor admitted. These medications are powerful and can cause liver toxicity, kidney damage, and, ironically, neurological side effects of their own. There's also a phenomenon known as die-off reaction. As the fungi are killed, they can release additional toxins into the bloodstream, potentially causing a temporary worsening of symptoms. Sarah absorbed this information, her hand unconsciously moving to her wedding ring, the one item she had refused to sell despite their financial difficulties. And if we don't proceed with treatment, the fungal infection will continue to produce neurotoxins. Given the progression we've observed over the past year, Doctor didn't need to complete the sentence. How soon can we start? Sarah asked. I've scheduled surgery for tomorrow morning, Doctor replied. Doctor will perform the procedure. He's our top infectious disease surgeon. The antifungal regimen will begin immediately afterward. Later that evening, Sarah sat beside James's hospital bed. He had been admitted that afternoon for pre-surgical preparation. Luna lay on a special mat beside the bed, the hospital administration having made an unprecedented exception to their no animals policy after Doctor had forcefully advocated for the dog's presence. "They found it," Sarah said quietly, holding James's hand. During the past year, she had developed the habit of speaking to him normally even when his cognitive state made comprehension uncertain. "The dog you thought was a waste of money." She smiled, remembering his initial skepticism when she'd first mentioned the medical detection program. To her surprise, James's eyes focused on her with unusual clarity. "Smart dog," he managed, the words slow but distinct. Sarah's breath caught. These moments of lucidity had become increasingly rare. "She is, and stubborn like someone else I know." A ghost of a smile touched James's lips, then his expression grew serious. Dangerous treatment. Of course he had understood more of the doctor's discussions than she'd realized. "Yes," she admitted, "but not as dangerous as doing nothing." James nodded slightly, then his gaze shifted to Luna, who had raised her head at the sound of his voice. "Stay with her," he whispered. "If I don't—" "Stop," Sarah interrupted, squeezing his hand. "That's not how this story ends." But later that night, as James slept, Sarah found herself wondering if she was clinging to false hope. They had found the cause, yes, but the damage might already be too extensive. The treatment itself could kill him. After fighting so hard for answers, she now faced an even more terrifying uncertainty. Dawn brought a flurry of activity as the surgical team prepared James for the operation. Doctor, a slight man with precise movements and quiet confidence, reviewed the procedure with Sarah one final time. "We'll remove the primary abscess and affected lymphatic tissue," he explained. "The procedure should take approximately 4 hours. Doctor will begin the antifungal protocol immediately after recovery." Sarah nodded, trying to project a calm she didn't feel. As they prepared to wheel James to the operating room, she leaned down to kiss his forehead. "I'll be right here," she promised. The surgery proceeded without complications, Doctor later reported. The primary abscess had been fully excised, along with several affected lymph nodes. Pathology had confirmed the presence of throughout the tissue samples. "Now we begin the hard part," Doctor warned as James was settled in the recovery room, still unconscious from anesthesia. "The next 72 hours will be critical as we initiate the antifungal treatment." Critical proved to be an understatement. 12 hours after the first dose of antifungals, James developed a high fever as his body reacted to the die-off of the fungal infection. By hour 18, he began experiencing seizures more severe than any previously recorded. The medical team rushed to control his symptoms, administering anti-seizure medications and cooling measures for the fever. "This is the die-off reaction I warned you about," Doctor explained, as Sarah watched a team of nurses pack ice around James's convulsing body. "The dying fungi are releasing their toxins all at once, rather than the slow leak he's been experiencing for months." "Will he survive it?" Sarah asked, her voice hollow. Doctor's hesitation spoke volumes. "The next few hours will tell us whether his body can weather this storm." By the third day, James had been placed on a ventilator. His body, already weakened by months of progressive illness, struggled to cope with the massive influx of toxins. The nurses had established a rotation, monitoring his vital signs constantly. Doctor rarely left the hospital, catching brief naps in the doctor's lounge between evaluations. Luna refused food, staying vigilant beside Sarah in the waiting room, occasionally emitting low whines when James's condition worsened, as if somehow sensing his struggle from 2 floors away. "She knows," observed quietly. "Medical detection dogs often form profound connections with their patients." On the 4th morning, as dawn broke over Boston, Doctor appeared in the waiting room doorway, exhaustion evident in every line of her face. Sarah stood immediately, bracing herself for news she had been dreading for nearly a year. but Doctor's tired face bore something Sarah hadn't seen in any of James's doctors for months, a genuine smile. "His fever broke an hour ago," she said. "The seizures have stopped, and his latest shows a significant reduction in toxin levels." She stepped forward, taking Sarah's trembling hands in her own. "He's turning the corner, Mrs. Mercer. Officer Mercer is fighting back. I can't feel my legs," were James's first coherent words after being taken off the ventilator. His voice, raspy from the breathing tube, barely carried across the ICU room where Sarah had maintained her vigil for the past week. "The neurotoxins affected your peripheral nerves," Sarah explained gently, brushing a strand of hair from his forehead. "Doctor says the damage might be temporary." Might, the word hung between them, neither willing to acknowledge the alternative. James had survived. The fungal infection was responding to treatment, the abscess had been removed, and the toxin levels in his bloodstream were steadily decreasing. But the road ahead remained shrouded in uncertainty. Doctor had been characteristically direct when discussing his prognosis. "The good news is that we've eliminated the source of the neurotoxins. The bad news is that we can't predict how much of the neurological damage will heal. Some patients recover significant function, others." She had left the sentence unfinished, her expression completing the thought more eloquently than words. 2 weeks after surgery, James was transferred from the ICU to the neurology rehabilitation floor. The room was larger, with windows overlooking the hospital's courtyard and space for Luna to resume her constant position beside his bed. The chocolate lab had become something of a celebrity among the hospital staff, with nurses and doctors alike stopping by to meet the dog who had accomplished what millions of dollars of medical technology couldn't. "She doesn't look like a medical miracle," one young resident observed as Luna dozed peacefully beside James's bed. "Neither do I," James replied with a hint of his old dry humor. Physical therapy began in earnest, grueling, often painful sessions that left James exhausted and frustrated. The therapist, a former military medic named, showed no mercy. "I know you can feel that," insisted during their third session, applying pressure to James's foot. "I can't," James argued through gritted teeth, sweat beading on his forehead despite the cool hospital air. "Your autonomic responses say otherwise. Your body knows that foot is there even if your conscious mind doesn't yet. Move to the other foot. Again, try to push against my hand." Sarah watched from the doorway, her heart breaking at her husband's struggle. The strongest man she'd known, the officer who had once tackled an armed suspect through a plate glass window, now fighting to wiggle his toes. Luna observed these sessions with unusual intensity, sometimes whining when James's pain levels spiked. During one particularly difficult afternoon, when James had thrown a cup of water across the room in frustration, the dog had placed her head on his lap, gazing up at him until his breathing slowed and his clenched fists relaxed. "She's better than any anxiety medication I could prescribe," Doctor remarked, observing this interaction during her daily rounds. The days blurred together, marked by small victories and crushing setbacks. James regained sensation in his right foot, only to develop severe muscle spasms that kept him awake for 2 nights. He managed to sit unassisted for 10 minutes, then couldn't repeat the feat for another week. The antifungal medications caused bouts of nausea so severe that he lost weight he couldn't afford to lose. Through it all, Sarah kept a detailed journal, a practice suggested by the hospital's psychologist to help manage the emotional roller coaster of recovery. Each night, she would record the day's events, the medical updates, the therapy milestones, the moments of clarity or confusion. On particularly difficult days, when progress seemed impossible, she would flip back through earlier entries to remind herself how far they had come. "January 12, she read aloud to James one evening as he rested after therapy. "You recognize today. Actually called him by name when he visited. First time in 3 months you've remembered who he is." James frowned. "I don't remember that." "That's okay," Sarah assured him. I remember for both of us." She turned the page. "January 20, you fed yourself breakfast, all of it without help. The nurses celebrated with us." These small victories, meticulously documented, became their roadmap through the wilderness of recovery. Each tiny improvement, a stronger grip, a clearer sentence, 5 more minutes of endurance, marked the slow journey back from the brink. By the end of February, 2 months after Luna had first alerted to the hidden infection, James had progressed to using a walker. His steps were unsteady, his legs still partially numb, but he could move independently for short distances. Luna would pace beside him during these halting journeys around the hospital floor, matching her gait to his laborious pace. "The dog's doing physical therapy," observed with a laugh. "She's compensating for his weak left side, creating a counterbalance." It was true. Luna had intuitively positioned herself to provide stability when James's balance faltered. No one had trained her to do this. She had adapted her behavior to his changing needs with remarkable sensitivity. In early March, doctors suggested that James might be ready for outpatient treatment. "Your blood work is showing no signs of residual toxins," she explained during a team meeting. "The antifungal regimen is working, and you're stable enough to continue rehabilitation at home with regular clinic visits." The prospect of returning home, a normal life still out of reach but at least visible on the horizon, brought both joy and anxiety. Their house would need modifications to accommodate James's limited mobility. Sarah would need to learn new care routines, and questions about their financial future loomed large, with medical bills mounting and no clear timeline for when, or if, James might return to work. The day before discharge, Sarah found James sitting in a wheelchair by the window, staring at the March rain pelting against the glass. "Second thoughts?" she asked, pulling up a chair beside him. "Not about going home," he replied. "About after." He looked down at his legs, still thin and uncooperative despite weeks of therapy. "What if this is as good as it gets? What if I never go back to the force?" Sarah took his hand, noticing that his fingers, once too weak to hold a spoon, now curled firmly around hers. "Then we adapt, like we've been doing every day for the past year." "I don't know how to be anything but a cop," James admitted, the fear in his voice more naked than she had heard since his diagnosis. "You know how to be a survivor," Sarah countered, "and right now that's enough." Luna, sensing the emotional current in the room, moved from her bed to press against James's legs, resting her chin on his knee. James absently stroked her head, the motion now smooth and controlled where once it had been impossible. "I couldn't have made it through this without you," he said quietly, and Sarah wasn't sure if he was speaking to her or the dog. "You haven't made it through yet," she reminded him with a small smile. "We're still in the middle." The next morning, a small crowd gathered to witness James's departure from the hospital. Nurses who had cared for him during his darkest days. Doctors who had doubted whether he would survive the aggressive treatment. Fellow officers who had held fundraisers and covered shifts to support Sarah through the ordeal. James insisted on walking out. Not in a wheelchair, not carried on a stretcher as he had arrived 3 months earlier, but on his own 2 feet. With the assistance of a walker, yes, and with Luna vigilantly at his side, but upright and moving forward under his own power. Each step down the hospital corridor was a victory lap, a silent rebuke to the 23 specialists who had given up, a testament to Sarah's refusal to accept defeat, and a tribute to the extraordinary dog who had found what everyone else missed. As they reached the hospital entrance, stepped forward with a surprise. The entire K-9 unit of the Boston Police Department had formed an honor guard, their service dogs sitting at attention as Officer James Mercer took his first steps back into the world. "Welcome back to the land of the living, partner," said, his gruff voice betraying more emotion than he'd intended. James nodded, unable to speak past the lump in his throat. The journey wasn't over, might never truly be over. But for the first time in more than a year, The path ahead seemed possible to walk. 18 months after Luna entered their lives, James Mercer stood unassisted at the podium of the International Medical Congress in Chicago. The cavernous auditorium was filled to capacity. Physicians, researchers, and medical students, drawn by the case that had been featured in the New England Journal of Medicine under the title Canine Detection of Encapsulated, a case study in diagnostic innovation. At 44, James was thinner than in his patrol days, his once robust frame reshaped by illness and recovery. The slight tremor in his left hand was barely noticeable as he adjusted the microphone. In the front row, Sarah watched with quiet pride, Luna sitting attentively at her feet. The chocolate lab wore a custom-made vest identifying her as both a medical detection dog and a service animal, the dual roles she had come to fill in their lives. "I should be dead," James began, his voice stronger than many in the audience had expected. 23 of your colleagues, brilliant physicians at renowned medical centers, missed what this dog found in one day. A ripple moved through the crowd, some uncomfortable shifting, some leaning forward with increased interest. James had refused to soften his presentation to spare medical egos. The truth of his experience, he insisted, was too important to dilute with professional niceties. "This isn't a criticism," he continued. "It's a call to humility and innovation. Modern medicine is miraculous, but it's not infallible. My case exposed a blind spot in conventional diagnostic approaches, one that might have remained unexplored if not for a dog's extraordinary capabilities." Over the next 30 minutes, James detailed his harrowing journey, the mysterious collapse, the baffling progression of symptoms, the parade of specialists with their inconclusive tests and failed treatments. He described the turning point, Luna's focused alerting to his right leg and abdomen, with the precision of someone who had studied his own medical records extensively. Doctor joined him on stage for the technical portion of the presentation, explaining the unusual encapsulation of the fungal infection and why it had evaded traditional diagnostic methods. Doctor followed, outlining the training protocols that had enabled Luna to detect what advanced medical technology had missed. The key wasn't superior technology, emphasized. It was a different approach altogether. Luna wasn't looking for predetermined markers of disease. She was identifying an anomaly in Officer Mercer's biochemical signature, a deviation from normal that our current testing parameters weren't designed to flag. As the presentation concluded, James returned to the podium for final remarks. 18 months ago, I was given weeks to live. Today, I'm standing before you without assistance. My recovery hasn't been complete. I still experience periodic neuropathy and fatigue, but I'm alive, largely functional, and have found new purpose." He gestured to the slide behind him, showing the logo of the newly established Mercer Foundation for Medical Detection Research. "Sarah and I, along with Dr., have created an organization dedicated to advancing the integration of canine detection into medical diagnostics. We're particularly focused on hard-to-diagnose conditions where conventional testing falls short." The applause was thunderous as James walked, slowly but steadily, from the stage without a cane or walker. Luna, released from her stay command, trotted to his side, matching her pace to his measured steps. Later that evening, at a reception hosted by the conference organizers, James found himself surrounded by physicians eager to discuss potential applications of medical detection dogs in their specialties. "Could this approach work for autoimmune disorders?" a rheumatologist asked. "We often struggle with patients who present with symptoms but test negative on standard panels." "That's exactly the kind of diagnostic gap we're exploring," James confirmed. "We currently have 3 dogs in training specifically for atypical autoimmune presentations." Dr. Foster, the neurologist who had initially dismissed Luna's alerting behavior, approached with the grace of someone prepared to acknowledge a mistake. "Officer Mercer, your presentation was enlightening. I've been following your case closely since doctor's discovery. James shook the doctor's extended hand without hesitation. Your skepticism was reasonable, given the information you had at the time. Nevertheless, Dr. Foster said, it's taught me to remain open to unconventional approaches when conventional medicine reaches its limits. I've referred 3 patients to your foundation's pilot program in the past 6 months. Across the room, Sarah chatted with the conference's keynote speaker, the director of the National Institutes of Health, who had expressed interest in establishing formal research protocols for medical detection dogs. Luna remained at her side, occasionally accepting gentle pats from admiring physicians who had once scoffed at the idea that an animal could outperform their sophisticated diagnostic equipment. She seems to be enjoying her celebrity, remarked, joining them with a glass of champagne. The NIH publication featuring her case study has been downloaded over 50,000 times. Fame hasn't changed her, Sarah replied with a smile, watching as Luna politely accepted another admirer's attention. She still steals socks and hogs the bed. The foundation's work had evolved rapidly over the past year. What had begun as a personal mission, understanding how Luna had detected James's hidden infection, had expanded into a comprehensive research initiative. They now maintained a facility in Boston where handlers trained dogs to identify biochemical signatures associated with difficult-to-diagnose conditions, rare infections, certain autoimmune disorders, and early-stage neurological diseases that eluded conventional testing. The police department had been unexpectedly supportive. When it became clear that James could not return to active duty, the commissioner had created a position for him in the Community Outreach Division, with flexible hours that accommodated his ongoing recovery and foundation work. 3 other officers who had participated in the RICO training exercise and developed milder neurological symptoms had been diagnosed with the same fungal infection, thanks to the protocol developed during James's treatment. Had become the foundation's most enthusiastic volunteer, helping to organize fundraising events and speaking passionately about his partner's near-miraculous recovery. My standard line is that I've spent my career working with K9 officers, he liked to tell potential donors, but I've never seen a dog solve a more important case. As the reception wound down, James found a quiet corner to rest. Despite 18 months of recovery, his stamina remained limited. Extended periods of standing or socializing still drained his energy reserves. Sarah joined him, slipping her hand into his. "You were magnificent up there." "I had good material to work with," he replied. "Hard to mess up a story with a literal X, or rather X. Doctor told me 3 hospitals have committed to pilot programs," Sarah said. "They'll be integrating detection dogs into their diagnostic protocols for patients with unexplained symptoms." James nodded, satisfaction evident in his expression. Change comes slowly in medicine, but it comes. Luna appeared at his knee, signaling subtly that his fatigue was reaching levels she could detect before he consciously registered them. This had become their new normal, the dog anticipating his needs, alerting to invisible changes in his biochemistry, partnering with him in ways neither Sarah nor the doctors could. "I think someone's telling me it's time to go," James observed, rubbing Luna's ears appreciatively. As they made their way toward the exit, James paused to look back at the crowded reception hall. Physicians and researchers now passionately discussing a diagnostic approach that had been dismissed as fringe 18 months earlier. "Not a bad second act," Sarah said, following his gaze. "No," James agreed, "not what I would have chosen, but maybe what you were meant to find," she finished. Outside, the Chicago night was cool and clear. Luna led the way to their waiting car, her mission, begun the moment she first detected the wrongness in James's biochemistry, transformed but not completed. The officer who nearly died had found new purpose in his second chance at life, while medical science had gained invaluable insights from a chocolate lab who had sniffed out what advanced technology had missed. Some might call it luck, coincidence, or desperation that had brought Luna into their lives at precisely the right moment. But watching the dog confidently guide her human companion through the darkness, anticipating his needs before he could voice them, Sarah preferred a simpler explanation. Sometimes the most sophisticated solution to a complex problem was the wisdom of a creature who saw the world through different eyes, or rather, a different nose.